Is cholesterol a lipid? Understanding the connection. Lipids are essential, fat-like substances that circulate in your bloodstream and are also found in every cell and tissue throughout your body. They play a vital role in storing energy, supporting cell structure, and regulating hormones. Among the different types of lipids, cholesterol is the most widely recognized. But are cholesterol and lipids the same thing? Not quite. While the terms lipids and cholesterol are often used interchangeably, cholesterol is actually a specific type of lipid-based compound. More accurately, cholesterol is a combination of lipid and protein, which is why it's transported in the body as lipoproteins, such as LDL, low-density lipoprotein, and HDL, high-density lipoprotein. In addition to cholesterol, another common lipid found in your body is the triglyceride. Like cholesterol, triglycerides travel through your bloodstream and contribute to your overall lipid profile. So, to answer the question, yes, cholesterol is a type of lipid, but it's more precise to say it's carried in the body as part of a lipoprotein complex. Understanding the role of lipids, including cholesterol and triglycerides, is key to managing your heart health and assessing cardiovascular risk. The function of lipids in the human body. Lipids play several essential roles in your body's overall health and biological function. While often associated with fat and heart disease, certain lipids, including cholesterol, are critical to life. Cholesterol, a type of lipid-like substance, is present in every cell of your body. Your liver naturally produces all the cholesterol your body needs, which contributes to vital processes such as the production of key hormones, the synthesis of vitamin D, the formation of enzymes involved in digestion, the development and maintenance of healthy cell membranes. In addition to what your body produces internally, cholesterol is also obtained from dietary sources, particularly animal-based foods. These include full-fat dairy products, red meat, processed meats like bacon. Maintaining moderate levels of cholesterol is essential for proper physiological function. However, excess levels of lipids in the bloodstream, a condition known as hyperlipidemia or dyslipidemia, can significantly increase your risk of developing cardiovascular disease. Understanding the balance of lipids in your body, especially cholesterol and triglycerides, is key to supporting long-term heart health and overall wellness. LDL versus HDL, how cholesterol types affect your heart health. When discussing cholesterol, it's important to understand that not all types are created equal. The two main forms, low-density lipoproteins, LDL, and high-density lipoproteins, HDL, play very different roles in your body. LDL cholesterol, the bad cholesterol. LDL, or low-density lipoprotein, is often labeled the bad cholesterol. Because when there's too much LDL in your bloodstream, it can lead to the buildup of a waxy substance called plaque along the walls of your arteries. This plaque narrows and stiffens arteries, reducing the space for blood to flow, a condition known as atherosclerosis, commonly referred to as hardening of the arteries. In more severe cases, these plaques can rupture, spilling cholesterol, fats, and cellular debris into the bloodstream. In response, your body triggers clot formation. Platelets rush to the site, and if the clot becomes large enough, it can block blood flow entirely. A blockage in the coronary arteries can result in a heart attack, while a blockage in arteries leading to the brain can cause a stroke. HDL cholesterol, the good cholesterol. HDL, or high-density lipoprotein, is often referred to as the good cholesterol. Its primary function is to remove excess LDL cholesterol from your bloodstream and transport it back to the liver, where it can be broken down and eliminated from the body. Although HDL makes up only about 1/4 to 1/3 of the total cholesterol in your blood, it plays a crucial protective role. Higher levels of HDL are associated with reduced risk of heart disease, while low HDL levels may leave more LDL in circulation, increasing cardiovascular risk. Triglycerides, the other key lipid. Triglycerides are another important type of lipid. They store and use calories in fat cells and provide energy between meals. However, consistently high triglyceride levels, often caused by overeating, lack of physical activity, or excessive alcohol intake, are associated with an increased risk of cardiovascular disease. Like high LDL, elevated triglycerides can contribute to artery damage, inflammation, and increased risk of heart attack and stroke. In summary, LDL, HDL, and triglycerides are all related to lipids, and yes, cholesterol itself is a lipid-like substance transported as lipoproteins. Managing these lipid levels is essential to protecting your heart and circulatory health. Measuring lipid levels, what you need to know. Understanding your cholesterol and lipid levels is an important step in assessing your risk for cardiovascular disease. A simple blood test, often called a lipid panel, measures key components in your blood, including low-density lipoprotein, LDL, often referred to as bad cholesterol, high-density lipoprotein, HDL, the good cholesterol, triglycerides, a type of fat stored in your cells for energy. These results are typically reported in milligrams per deciliter, mg/dl, and standard targets include LDL cholesterol, less than 130 milligrams per deciliter, HDL cholesterol, greater than 40 milligrams per deciliter, triglycerides, less than 150 milligrams per deciliter. Beyond the numbers, focus on risk reduction. While lab values provide helpful benchmarks, healthcare providers often take a more comprehensive approach, focusing not just on numbers but also on your overall risk for heart disease. Depending on your health profile, your provider may recommend lifestyle changes such as improved diet, increased physical activity, and weight management, even if your numbers are within range. How LDL is calculated and why it matters. Traditionally, LDL cholesterol has been calculated using the Friedewald formula. LDL equals total cholesterol HDL, triglycerides divided by 5. However, researchers at Johns Hopkins University found this formula can underestimate LDL cholesterol in people with elevated triglyceride levels, above 150 milligrams per deciliter. In such cases, LDL may appear lower than it truly is, potentially leading to a false sense of security. As a result, updated and more sophisticated formulas are now used to provide more accurate LDL estimates, particularly in patients with high triglycerides. How often should you test your lipids? Most healthy adults should have their cholesterol levels checked every 4 to 6 years, but more frequent testing may be recommended if you have a personal history of heart attack or stroke, live with high blood pressure or diabetes, have a family history of heart disease, are a current or former smoker, have recently started a cholesterol-lowering medication, are managing high LDL or triglyceride levels. It's also worth noting that LDL levels tend to increase with age, while HDL levels may decline in people who lead a sedentary lifestyle. Monitoring these trends over time can help your doctor adjust your prevention or treatment plan accordingly. Treatment options for high cholesterol and lipid imbalances. While dyslipidemia, a condition characterized by abnormal lipid levels in the blood, is a significant risk factor for heart disease, it is often manageable with the right approach. For many individuals, a combination of lifestyle changes and medication can effectively bring lipid levels, including LDL cholesterol, into a healthy range. Statins, the first line of treatment. Statins are the most commonly prescribed medications for lowering LDL cholesterol. These drugs work by blocking an enzyme in the liver responsible for cholesterol production, effectively reducing the amount of LDL circulating in the blood. Statins are generally well tolerated and supported by decades of clinical research. There are multiple statins available, each with slightly different mechanisms, but all aim to reduce LDL levels and lower cardiovascular risk. If you experience side effects, such as muscle aches or fatigue, it's important to discuss this with your doctor. Adjustments such as lowering the dose or switching to a different statin can often resolve symptoms without sacrificing effectiveness. In many cases, statins are taken long-term or even for life. It's essential not to stop or alter your medication unless specifically directed by your healthcare provider, even if your cholesterol levels have improved. Additional cholesterol-lowering medications. For individuals who don't respond well to statins or require additional lipid control, other medications may be prescribed, including bile acid-binding resins, help the body use excess cholesterol to produce bile. Cholesterol absorption inhibitors, block cholesterol uptake in the small intestine. Combination therapies, such as statin plus absorption inhibitor or statin plus niacin. Fibrates, primarily lower triglyceride levels and raise HDL cholesterol. Niacin, vitamin B3, lowers LDL and triglycerides while boosting HDL. PCSK9 inhibitors, injectable biologics that dramatically lower LDL levels, especially for people with familial hypercholesterolemia or high cardiovascular risk. A comprehensive strategy. Medications alone are not enough. Long-term success requires a healthy lifestyle that includes a heart-healthy diet low in saturated fat and added sugars, regular physical activity, smoking cessation, limiting alcohol intake, weight management. With proper treatment and lifestyle habits, most people with high cholesterol or other lipid disorders can effectively reduce their risk of heart attack, stroke, and other cardiovascular events. Tips for managing cholesterol, lifestyle strategies that work. While medications like statins play a critical role in cholesterol management, long-term success also depends on consistent lifestyle changes. Improving your daily habits can help enhance your lipid profile, reduce your reliance on medication, and lower your overall risk for heart disease. 1. Follow a heart-healthy diet. Adopting a diet that supports cardiovascular health is one of the most effective ways to lower LDL cholesterol and triglycerides. Focus on reducing intake of saturated fats and dietary cholesterol. Limit red meat, fatty cuts of meat, processed meats, and full-fat dairy products. Increasing intake of fiber-rich foods. Incorporate whole grains, legumes, nuts, fruits, and vegetables into your daily meals. Soluble fiber, in particular, helps block cholesterol absorption, minimizing added sugars and sodium. A balanced, nutrient-dense diet is low in added sugars and salt, both of which contribute to cardiovascular risk. If you're unsure where to start, your doctor can refer you to a registered dietitian to help you build a sustainable, personalized eating plan. 2. Get regular physical activity. Engaging in regular exercise can lower LDL cholesterol and raise HDL cholesterol, improving your overall lipid balance. The American Heart Association recommends at least 150 minutes of moderate-intensity exercise per week, such as brisk walking, swimming, or cycling. For even greater benefits, aim to incorporate a mix of aerobic activity and strength training throughout your week. 3. Monitor your lipid levels consistently. Routine blood work is vital for tracking progress and adjusting your treatment plan. Lipid levels can fluctuate significantly over time due to age, weight, activity level, and other health conditions. Stay informed about your cholesterol profile by following your doctor's testing schedule, reviewing your lab results annually or more often if recommended, communicating openly with your healthcare team about your medications, lifestyle, and goals. 4. Other key lifestyle changes. Avoid tobacco. Smoking lowers HDL and damages your blood vessels. Limit alcohol intake. Excessive drinking can raise triglyceride levels. Take medications as prescribed. Don't skip or stop any treatments without consulting your doctor. Bottom line, cholesterol is a lipid, but not all lipids are the same. Managing your LDL, HDL, and triglycerides requires a comprehensive approach that includes diet, physical activity, and proper medical guidance. Want to learn more about heart health, cholesterol, and how to protect your body from within? Subscribe to HeInfo for expert-backed insights and easy-to-understand explanations on managing your health, one topic at a time.